stretch, do whatever you got to do. You might learn a few stretches as we go, so then you guys can just start them while you're in the audience here. So welcome to our low back pain and sciatica workshop. I think I know pretty much everyone here, but I'm Luke Gordon. My dad and I, hey, I know you. My dad and I, Robert, are owners of the clinic. We're both physical therapists. And then Stephanie just agreed to come and help us out on a Saturday morning. So welcome all here. Anyone who hasn't been here in a while, did you notice that we're in like a different area all of a sudden? Yeah, is that new to most people? Okay, yeah, so that little piece back there was the wall. So we would have gone straight through that treadmill. So all of this is new stuff. So if you haven't seen it, feel free to wander around. We've got a couple new treatment rooms, massage therapy room, and staff room. If anyone needs the restrooms while they're here, they're just out that back door there. And it looks like we've got lots of extra coffee, and there's water and snacks back there. So help yourself. You certainly don't need to sit the whole time. I'm going to kind of run through the presentation here, and then I'll have time for questions at the end. But if you have anything that you're dying to know as I'm going, or if you want clarification on something, feel free just to shout it out or raise your hand. You don't have to raise your hand, just shout it out. Small enough group, so feel free to stop me if you'd like. Okay, so we're going to just jump into some basic stuff about the back. And when you look at the back, you're looking at kind of the back and the pelvis and the hips, kind of everything in the immediate area, and different structures that surround your back. The vertebrae are just the bones. So the vertebrae, everyone heard of like lumbar vertebrae. You've got 5 of them that sit on top of your pelvis. I've actually got a little light on this thing too, so I'm going to use it just because I can. So these are your vertebrae stacking up here. And this is your sacrum here, kind of that triangular shaped thing. Pelvis is off to the sides here.
Can I ask where the L4 is? Just
L4, yeah.
You're right there.
For sure. So L5 is the very bottom.
Okay.
4, 3, 2, 1. If you look at that on a spine, I've got them numbered on there.
Okay.
5, 4, 3, 2, 1. What's that? Yeah, S1. S1 would just be the sacrum.
Really, yeah.
So your sacrum is actually 5 bones that are fused.
Oh.
So have anyone here had like an X-ray or an MRI before? Probably a lot of you.
I just did.
Yeah, everyone's raising 2 hands on that one. So a lot of times they'll say like, you know, changes at L2, 3, 3, 4, 5, and then the bottom segment you'll hear, which is the most common segment, would be L5, S1. So that's just where your L5 vertebrae sits on top of your sacrum. That's what you got. So those are your bones. And as I mentioned, you have your pelvis surrounding that. Pelvis is more or less 2 halves. So this is your pelvis here. In the front, just below your belt line, that's where it connects at your pubic symphysis there. So your pubic bones are right there connecting. In the back, it's going to connect right where your SI joints are. And then your sacrum is that triangle right between them. So that's a big part of your back as well. You've got the discs, which probably a lot of you have heard about your discs or wondered about your discs. Those are just those spacers there between each of the bones. Those are the discs. So again, if you look on the model of the spine, you've got those up and down your entire spine. Those little squishy cushion type things are your discs. So again, typically if you've had an MRI, you'll hear them talk about your discs. Mild disc bulge here, moderate, stuff like that. MRIs are more useful for that soft tissue stuff. The rest of your spine, of course, going up the chain, you've got 12 vertebrae on top of that that are thoracic, we call them. And then above that, your neck is cervical. You got 7 of those. And then you've got your skull sitting on top. So similar structure throughout. The bones change shape a little bit. And then you've got, this is probably my next one, muscles surrounding. One more thing back on the spine before we talk about muscles. Along each side of the spine, you've got these little holes, certain amount of space between each of the 2 bones where your little nerve roots are popping out. So again, if you had an MRI and it said you've got a disc bulge at L4-5 and it's impinging on the L4 nerve root, that's what it's talking about, this little nerve root here. Those are all coming off your spinal cord, which your spinal cord is protected by the back of your spine. All those little knobs you can feel, those are those little knobs coming off each of those backbones. So the spinal cord itself is inside there. You won't typically have too many issues with a spinal cord unless you've got severe stenosis, which I'll tell you what that is later. But typically most of your back injuries, if you have a nerve involvement, it's going to be those little rootlets, those little roots that are popping out at each level. So basic anatomy of the spine there. Any questions on anatomy? Lots of muscles. You got little muscles, you got big muscles going along your spine, along your hips, crossing your pelvis, crossing your sacrum. All good stuff. Of course, all good stuff that can be turned into bad stuff, unfortunately. Okay, so what causes back pain? Lots of stuff causes back pain. We'll go through kind of the top causes, though. Sitting is a huge one. If you've ever read, I guess, any of my emails or blogs on back pain, or just read about it in general, got you all these nice hard chairs for this presentation, so feel free to stand up and move around. But prolonged sitting especially is a really big issue with back pain, mainly because of the compression, the sustained compression. Interestingly enough, sometimes it feels good to sit if you have back pain, but then usually it doesn't feel good to stand back up. So it might feel good for a short while and you gotta stand. So that's a big cause of back pain. The wrong type of exercise, we're going to talk about that a little more later. But basically, depending on the type of back pain you have, there's good exercises and bad. So good movements that can help correct your pain, and on the other side of the spectrum, just the opposite movements will make your pain worse. And nowadays with things like YouTube and Google, it's really easy to just say, oh, let's just check out some exercises and apply these to my back pain. If you don't know what type of back pain you have, it's really easy to mess up on that and do the wrong type. Postural changes, that goes into sitting as well, but standing postural changes as well. Just changes in your back, and that can affect muscle imbalances and stuff like that as well. So, you know, your mom always told you to stand up straight. And in PT school, they always told me that because I'm quite a sloucher. I still kind of am a little bit of a sloucher, but I'm trying. You got to practice what you preach. So that can cause back pain as well, though. And the big reason that would cause a change in your back pain is that when your posture changes, all of the forces throughout your spine, be it the forces through those discs, the forces through the joints, or the stretch or the contraction of the muscles, it all changes. And over 20, 30, 40 years, those changes that were reversible at first are now becoming more sustained. And so you really got to watch those things going forward. Those are big causes of back pain. So we're going to break back pain into 4 types of back pain, basically. We're going to talk about SI joint dysfunction, which we'll get into in just a minute here. Sciatica, which is a big one for a lot of people. Muscular pain. And then we'll talk about the degenerative types of pain, so the discs and the joints degenerating. So SI joint dysfunction first. The SI joints are those joints where your pelvis meets your sacrum. So it's sacroiliac. You don't necessarily need to know that, but that's where your sacrum fits in here with those little bones. For most folks, it's like 2 little dimples on the back of their spine. So if you feel along your pelvis, you'll feel that. This type of pain is, depending on who you talk to, this type of pain is super common or it's not common at all. I think from most of our perspectives in PT, it's quite common. It's just a matter of what's causing it, and if you need to treat that, or if you need to treat the underlying cause. So here are some common signs of SI joint pain. A lot of times you've got difficulty putting your socks and shoes on, bending forward. Typically pretty stiff getting out of bed in the morning. Sitting and standing can increase pain, especially sitting for people with SI joint pain. They tend to sit like way off to one side to kind of like space out one of the joints. The nice thing with SI joint pain, not nice, but if you have it, it typically is fairly localized. So you can typically go, I hurt right there. And it doesn't usually radiate down your leg. It can cause sciatica, but not super common unless there's just a bunch of irritation all around it. So it's somewhat easy to diagnose, not all that easy to treat because there's weird things that go on with your sacroiliac joints.
Luke?
Yeah.
Can that, you say it doesn't cause sciatica, can it go anywhere else?
Well, it can cause sciatica. There's
Yeah,
enough irritation.
Okay.
Typically it doesn't, it's not too, yes, it could. It could cause a little pain. Usually it's because it's either caused by another type of pain or it is causing another type of pain. So it usually, the SI joint pain itself typically stays right there. But if you've got that pain because of you've got a couple locked joints or you've got some tight muscle imbalances, you typically have more types of pain. You just don't typically get a ton of pain down your leg, but it can cause it.
No, I wasn't thinking down the leg, I was thinking more localized in that area.
Definitely. One thing to keep in mind too as we go through is you say, well, what type of, the 4 common types of back pain, which one do I have? It'd be nice if you just had one, but it's possible you have 2. Sometimes if you're unlucky, you might have 3. You have to kind of ferret out which one is causing this or which one's causing that. So some my use of the word ferret for the day. Right? Once a day is recommended. Okay. So here's some issues again with SI joint dysfunction. A lot of times, like I was just mentioning, you've got joints on the lower back that are stiff, or they're kind of locked up. And so what you'll get then is any of that movement or the force that should be going through those joints will then shift down the chain and then end up causing movement or irritation of those SI joints. The SI joints are kind of funky, like I mentioned. They're actually not like a smooth joint. You think of a joint like hinging and unhinging, or maybe a smooth surface, like a rounded surface and a concave surface. The SI joints are like this. They're like a bunch of rocks and just scraggly. And so it's, to have the force transmitted through there and just kind of rubbing those weird areas against each other can cause a lot of irritation. Oftentimes, again, the back is very stiff. And what we'll see, sorry it's a little blurry in the bottom there, what we'll see sometimes is that you will see the SI joints will actually shift. So the pelvis, again, is two halves. It can rotate. So you'll see here the circles on the back will be in different spots, or you could have like a shift of your pelvis. A lot of times that goes with like a leg length discrepancy if you have one. So you might see someone, this is a good common one after like a hip replacement. And hip replacements, they do their best to make your legs equal. But has anyone here had a hip replacement? Or known somebody? Oh, Jerry, you had one? Yeah.
I have
Two, yeah. Did you notice any difference in your leg lengths afterwards at all? No? Good. My brother had one at 32, unfortunately, and his new leg, is it shorter than the old one?
I think it's longer.
Longer?
Yeah.
It's a good inch and a half longer, though.
Wow.
That's
Well,
not
it might
super
be,
common with a total hip, but
It might be as much as 1/8 of an inch, if that, but they used a laser when they
Oh,
replaced
yeah.
mine.
you had one of the newer ones. Yeah. Yeah, and so the surgeons are very careful about that, but it's not an exact science when they do that, so you will get people who have a good inch off, and that can just really change the alignment of those joints. Another common one is anyone with like a real bad knee, total knee, stuff like that. So if your knee is really arthritic, a lot of times you can't straighten it, and so what will happen over time is that leg will be shorter functionally, and that could be for years. And then you come out of surgery or whatever, and we talk to people about the knee pain. They say, "Hey, do you have back pain by any chance?" I'll go, "Oh yeah, I have back pain." Or Susan, you're sporting a walking boot today.
Yeah, I am.
If you don't match that walking boot, which has a thick sole on it, with another thick-soled boot, do you notice it?
Yep.
Yeah, big time.
I'm about as matched as I can get, and my SI joints and
Yeah.
piriformis muscle, they're all screaming.
Yeah. So you see someone come in like a walking boot, and those walking boots, the sole on them is like that thick, and they're wearing their tennis shoe, which is like that. So all of a sudden they created a leg length discrepancy. So we always say, "Hey, how's your back doing?" Like, "Oh God, it's horrible. I'm coming to PT for my ankle. My back is just killing me." So we'll try to help them out. Something like that, if it's temporary, you can just use like a leg lift or a heel lift. So some of it's easy solutions and some of it's not. Cool, so that's SI joints. Sciatica is a big one. Raise your hands, people with sciatica. Yeah, okay. That's a fun one, right? So you already know this pain. Pain down the back of the leg is real common. You can get numbness and tingling, pins and needles as low as the feet. This is an interesting one to talk about with where do you hurt. So if you have sciatica that's related to a disc bulge, typically you're going to feel worse if you bend forward, because it's going to push the disc back farther towards those vertebrae. If you have sciatica more from a chronic stenosis or narrowing of the spine, or like a compressive force on the spine, typically bending forward actually feels good, and bending backwards feels worse. So that goes back to what's causing your pain, and which exercises work based on the cause. Because if we gave back bending exercises to a person who has for everyone who came in with sciatica, half people would probably feel better, half people would feel worse. So you've just got to know what you're dealing with. Again, you can get pain all the way down the leg. A lot of people will get sciatica just into the buttocks. The next step is kind of like back of the knee. And then if you've got a severe sciatica, it's all the way down the leg.
When I notice, like, when I go with my boyfriend to the west side, if I sit in the car, my leg still gets the pain down the back, and it really hurts. I don't get it so much standing up anymore. Why
Yeah.
is that?
You probably have more of the compressive pain because as you're sitting, your spine is compressing. And actually, when you sit, you have a lot more pressure on your spine than when you stand and walk. It doesn't really make sense that much because when you sit, your spine is still
Because
vertical.
even right here, it hurts.
Even in your hip and groin. Yeah.
Well, like just right here.
Yeah. Yeah, and I'll get to some pain distribution patterns here in just a minute too. But a true sciatica, irritation of that sciatic nerve, which is that big nerve that runs all the way down the back of your leg through your buttocks. It's about as thick as your thumb. It's down the back of the leg. If you have numbness, tingling, symptoms up higher.
I have it
usually
in my
it's-
thigh.
Yeah, usually that's higher up in the back, so it's not quite as low as the sciatic nerve. Or if you have pain in the groin, that can be more like hip joint pain. Go ahead, Jerry.
You know, I used to have that sciatic pain a lot until I had my hips replaced.
Really?
Yeah, so pain
once
right
that-
here is typically your
And
hip
it went
joint.
away?
Yeah.
Really?
You have pain right in front of your, kind of like your groin,
You know, and,
It's like just
even back there.
right here.
Yeah.
Mine is right here.
Yep. So again, nerves get
Yeah.
pinched, and basically, who mentioned piriformis? You did, right, Susan? That's a muscle deep in your buttocks. Sciatic nerve is running right down. A lot of people it runs through that muscle. Some people it runs right underneath it. So if you get that piriformis muscle irritated, you can get sciatica. Basically, the way nerves work is if you touch a nerve in any way, like if you hit your funny bone before,
Yes.
so you get that pain all along the distribution of that nerve down your forearm. It doesn't go up the nerve distribution, it just goes down the nerve distribution. So if you touch that sciatic nerve anywhere, you either touch it at the roots up here, or you touch the actual nerve down here by a tight muscle, you will get potentially pain and tingling all the way down that nerve. More severe, of course, it's going to go farther and more intense.
Oh, it
You
gets
just gotta
really
lie.
intense if I sit for a long period of
Yeah,
time.
if it's just light, you know, it means we have a little bit of tension. So that's what's wrong with sciatica. And again, the bulging discs or the slip discs, they're very common things, just talking about severity, so that can touch those nerve roots again. And there's your nice picture of sciatica. Starting typically in the buttocks, sometimes as high up as the lower back, but a lot of times it's the buttocks and just shooting all the way down. And that, again, the distance tells you more about the severity, things like that. Any other questions on sciatica? We're going? Does the disc bulge thing make sense to people? Kind of, sort of? Yeah. So the easiest way to tell if your sciatica is a bulging disc is to bend forward. And if that hurts, typically it's a bulging disc. And if it feels better to bend backwards, typically it's a bulging disc.
I guess I would ask a question.
Yeah, go ahead.
I think it's common sense, but the difference between a bulging disc and degeneration, obviously one's big and one's small.
Yeah.
Okay.
So a bulging disc, you tend to think of a bulging disc, and so the disc is like a jelly substance in a casing, if this was like a big disc. So it's squishy. It compresses, it squishes around as you move. A bulging disc would be like some of that jelly pushes back through the casing, or just pushes the casing out a little bit. We tend to think of a disc bulge as something that's treatable, so meaning that you can put it back where it belongs. That, or the average, they say 80% of us just walking around have disc bulges where it's not touching anything, and the disc bulge itself doesn't generate pain. So that's, you don't get it. When you get into like a disc rupture or a herniation, that's just a more severe version of that, and those are much more difficult to replace. And if you have a true disc herniation, like the jelly completely escapes the casing, you can't put it back. Those are people that are usually surgical candidates. And those are easier to spot, and chances are none of you have that because you wouldn't be able to probably even sit. That's like extreme severe pain, and nothing you do can get rid of it. You can't find a comfortable position. You can lay on your side, curled up like in the fetal position. Anything you try just won't do it because you can't move that disc anymore. That portion of it is now doing its own thing. So
What's a degenerative? It
disc.
just sort of disappears, yeah, or what?
Yeah. I think that's next.
Oh, okay.
Let's get into that. Is that next? Oh, muscular. It'll be after muscular.
Okay.
Is that okay? All right. Muscular pain. You can get muscular pain anywhere, honestly. One of the nice things with muscular pain diagnostically is that you can usually touch it. It's usually tender to the touch. So you've got tightness across the big muscles in your back. You can get aching into the hips, things like that, the buttocks, sides of the hips. Real stiff getting out of bed because you laid there and the muscles tightened up overnight. And then with muscle stiffness or pain, you tend to ache toward the end of the day as the muscles are working, they're tightening up. Maybe you've even had a muscle spasm before. If you've had a muscle spasm, you know they're not comfortable. There's a difference between like a muscle just kind of sitting there and twitching away, A spasm is like it grabs you and like won't let go. So I had that once working for my brother years ago, and we were spending all day moving basalt. We did landscaping, moving basalt rocks, and we did that for 2 days straight. And it was probably moved, I don't know, 10, 20,000 pounds of basalt. And on the way home, I was driving down Argonne. My back just goes, just grabbing. All of a sudden, I can't breathe. I was like, oh my god, I was going to drive the car off the road. Yeah. Of course, we were working under the table back then, so there's no L&I or anything, right? So laid on ice for a day, went back 2 days later. But if you had that, you'll know it's a spasm. It's not quite like, oh, my legs are twitching. You know, it's like, no, it's super painful.
I have a quick question.
Yeah.
If you have, like, say, degeneration in the lower part of your spine, would that cause muscular back pain at the end of the day?
Good question. Yeah, actually, the muscle pain and spasms can just be a symptom of an underlying back issue. Yeah, so you've got a really painful, it's common with, if you are like pinching on a nerve and you'll go back there and the muscle will be spasming, like a low-grade spasm, not like the intense spasm. It's common because those muscles are trying to brace you. It's like a protective mechanism. So they're trying to support your back and say, well, don't move, let it just heal and let it go away. So they'll do that. Good question. So that's muscular. Common stuff we see with muscular pain, a lot of times the core muscles are weak. Those are those muscles that wrap around from your hips up to your rib cage and spine. A lot of times those will be weak. And what you'll get if you have weakness in those deeper core muscles is that your big muscles will start to work more than they need to. Muscular pain, I'll also say, is common in people with physical jobs. So if you are lifting a lot, you know, it's easy to work on or to irritate those muscles. The weekend warriors are a good instance too. Any weekend warriors in here? So you didn't do anything all winter, but you know, for me the leaves are still falling on my house because we have oak trees, so they're still falling. Okay, I'm just gonna rake leaves for an hour, or it's time to plant in the garden, right? Yeah. So let's put in 3 or 4 hours of garden work, and meanwhile you've been sitting all winter. So that's an easy way to strain your muscles. You can cause more damage than just muscles, but good example there. Okay, here's the degenerative stuff then.
Okay.
So tend to just put degenerative stuff into degenerative discs and degenerative joints. Has anyone heard these terms on an MRI or X-ray? Degenerative joint disease, DJD. Okay, a lot of people. Degenerative disc disease, DDD. Okay, so basically what that means, if you look back at the spine, if you have degenerative joints, the joints are these little fluffy things again on the model here. If they were this thick, as they degenerate, they just shrink. So they just get smaller. So with degenerative discs,
What's degenerative bone disease?
similar to joint.
Because that's what my doctor told me I have.
Yeah, a lot of equal terms for all this stuff. A lot of technical medical mumbo jumbo, but yeah, a lot of it's very similar. Degenerative typically just means things are getting closer together. So again, that disc was this big, now it's this big. The discs are spacers too. So if you look at the disc between these two bones, creates a certain amount of space between it for that nerve root to exit. So that's why if you have severe degenerative disc disease, that space shrinks down and all of a sudden you have pressure on that nerve root, especially if you sit for a long time or you stand for too long. And actually, one of my good friends from college just came back in this week. He's only 34, but he was a pharmacist, 12 hours a day on his feet. He's got a history of degenerative, like congenital, so they're born with it in his family. And it got to the point where all of a sudden he's got this sciatica just shooting down both of his legs. The doctor writes the referral and says it's a disc bulge. So I'm checking him out. And it's basically the exact opposite of the disc bulge. It's a degenerative process in his back. And when he's on his feet for 12-hour shifts, 6 days in a row, about twice a year, it just flares up on him. And so again, if he had a bulging disc, I would say, well, work on your back bends to reduce that disc bulge. But for him, it's the exact opposite. You got to work on forward bending type stretches to relieve the irritation, let the nerve calm back down, and then we'll figure out how to prevent it in the future. So it's a good example of making sure you're dealing with the right thing. If I had just treated him like a bulging disc, I would have just been putting him through the roof of pain and said, well, try your best,
Does arthritis cause that?
Yes. Very synonymous term. So degenerative joint disease. The joints on your spine are towards kind of the side and the back. So between each level there's 2 joints. Actually, I've got a good picture on the next slide. This is what it feels like. Mainly that pain, it will center in the center of your spine. You can get sciatica again, but you typically have severe pain in the spine. It can be intermittent at times, because if you relieve the pressure, it can go away, depending on how much irritation you have. So here's a decent, can people see that okay? So right there, you'd say that's like a normal disc height there. And right here, that disc is shrunk. And the little bubbles popping out are just inflammatory chemicals and stuff. The joints are back here. Sorry, it's kind of blurry on this, but the joints are back here. So you got joints at each part of your spine that allows you to move, do all your different movements. When those become arthritic, they just call it degenerative joint disease, or they'll call it, you just call it arthritic. And again, you can get irritation. Since those are actually joints and you get pain in your joints, you can get pain in the joints themselves. And if you get enough, you can get like bone growth around there too. That can actually impinge on those nerves as well. So that's what we were just talking about. The discs, the cushions lose their height. The joints become arthritic and compressed. So again, typically you bend backwards and this hurts.
Yes.
Sit too long, it hurts.
So when you lose that cushioning, then it promotes arthritis?
Not necessarily. Your arthritis is more the joints here. It can definitely, because everything's compressing now. So yeah, a lot of times if you have degenerative disc, you will have some degenerative joints.
Okay.
Not 100% of the time, but definitely you've got more compression there.
Can the discs be inflated?
That's pretty
Put some gel in them?
debatable. It's
Oh.
pretty debatable. Not in general. Not in general.
Not general.
You can do things like decompression to treat it, traction. A lot of times being in a pool feels really good because you can unweight the spine. Nowadays, have you guys seen inversion tables before? That can help distract it. Sometimes you might get a little benefit there. It's usually fairly permanent.
Go into space.
Do you agree with
I
that,
was just
Susan?
gonna say that.
Do you agree with that?
I would.
Yeah.
I was.
So is there a way of keeping them apart?
I'm gonna volunteer to the next
Yeah.
space
Yeah.
shuttle shot.
Watching the things we talked about, watching prolonged sitting, watching your posture, you know, avoiding
Yeah,
heavy lifting.
baby dying.
Okay, so here's a few mistakes. Ask yourself, are you making these mistakes? Using ice or heat, that's a common one. All that's fairly debatable too, really, depending on which therapist you get that day. But, you know, if you're real inflamed, we tend to say use ice. You know, if you're real inflamed, like acutely, just started bothering you because you did something and you're using heat, typically heat will make it feel worse because you're actually making it more inflamed. And then if you're just real stiff, has anyone ever run across someone who said, if I use ice, it just floors me, everything tightens up and I can't use ice on my back? Yeah, if you know that about yourself, then probably don't use ice, you know, it makes you feel worse. Good advice, right?
Yeah.
Yeah, okay.
Okay, but that's a really hard determination to make.
It is.
You
You've gotta know yourself a little bit, and you know, if you're just really stiff and tight, a lot of times heat feels good, and if you know your body enough and you've used heat when you felt real stiff and it helped, keep using heat.
I thought I knew my body till your dad started working on me.
The good way or a bad way.
Yeah, remember, I'm seeing you later this week.
Oh no, he got me to like it.
What I see a lot with the heat is people use too hot of heat and then you
Yeah.
inflame everything.
Yeah, you gotta be careful. Too hot or too long.
Mhm.
You know, in general, you use ice or heat for 15, maybe 20 minutes, and then, and you know, a lot of people have good luck alternating too. Because when you alternate, you change the blood flow in and out of the area. So there's benefits. Again, if you ask 5 or 10 PTs the same question, you'll get 5 or 10 probably different answers. But I think the best advice you can say is that if you know your back and you've tried them in different situations and one works for you, then go with it. Despite if I tell you the opposite. You know? Resting too much, that's a big one. So it's natural to want to rest when you feel bad. But that's natural for a day or so, maybe 2 days. If you rest too long, you end up having other issues besides your back pain. So you end up having issues going down the road. You end up being weak or fatigued. And so resting too much is a big issue for people.
That's the other one, to convince people to get up and move when appropriate,
Yeah.
of course.
Yeah.
That they'll feel better.
A lot of times, yeah, you gotta get going, but yeah, take a little short walk and go. Yeah. Masking with painkillers, this is super common nowadays. I mean, I don't think we can overemphasize that one enough.
Too
I mean,
too
if
much
you-
pain medicine, then they do too much.
Yeah. You go to the ER and they're gonna give you pain meds. Doesn't mean you should take them. You know, because your body is telling you something, and yes, you should. If it's super severe, you should rest. You know, but the last thing you want to do is cover the pain and then do too much and prolong your issue. Yeah.
Well, I don't know. Sometimes I want to cover.
Sometimes you want what?
Sometimes you want to cover. Just saying.
Well, yeah, if you're just gonna rest, you need to sleep or something. There are plenty of good uses for painkillers, but for your typical back pain, chronic back pain, you know, it's just that's a whole can of worms.
It wears on you.
Yeah.
Yeah, for sure.
Yeah. And we already talked about this at length, doing the wrong exercises. Gotta know that. So here's some real easy tips for general back pain. Again, heat typically, if you're stiff and tight without really like severe irritation, use some heat. Again, 15-20 minutes just to loosen yourself up. Ice again is usually used for pain and inflammation. If it works well, keep going. And these are things that if you were doing more strengthening on your own or into the future, Pilates is great for core strengthening. You can do a lot of the stuff on your own, or there's classes because that kind of keeps you accountable. And then yoga is great for stretching in general. So part of the hardest thing I think with treating your back is that you come to physical therapy and we get you through in usually about 4 or 6 weeks, sometimes longer depending on what you got. And we give you a certain amount of exercises. But I think we can all be honest with ourselves and say that the home exercise program is extremely boring, right? I mean, I gave you 6 exercises to do for the rest of your life. You know, not going to happen. And we can do a survey of people who are still doing the home exercise program after even like a week, and the average person isn't doing it. So at some point, you've got to transition to something that you enjoy. And a social setting like a group exercise class is a great way to do that because it is fun and enjoyable. I don't like yoga personally. My wife loves it. I like more intense exercise, but for me, as long as I keep myself strong and flexible, which I'm not that flexible, that works for me. You know, so you got to find what works for you.
I have a question.
Yeah, go ahead.
I love Pilates, but I'm afraid to do it now because of my back. So
That's a
when
common
do I
one.
know it's okay, or do I just have to kind of test the water, you know?
You can test it on your own and modify as able, or I mean, if you do end up seeing a physical therapist, usually we can walk you through that and we can kind of help you bridge the gap. The one thing I will say with Pilates and yoga is that it's really easy to do those with bad form, and you know, there's some Pilates classes that are very intense, and there are some that are easier, and there's some intermediate. So you gotta.
Well, I do it at home, so.
Yeah. Okay. So you know what you're doing.
Yeah.
There's ways to modify almost every exercise too. And so just knowing what you can and can't do. An easy guideline for exercise, and it's just typically if you're doing an exercise and it like hurts while you're doing it, typically you shouldn't do it. Unless you can modify it so it doesn't hurt. Having some muscle aches and pain afterwards is actually sometimes is kind of good. But pain while you work out, not so good. Stretching type feelings is great when you're trying to stretch muscles, but like actual sharp pain. Would you agree with that, Dad?
Yeah.
Yeah? Cool. Okay, so those are some tips just to help you on your own. If you sit a lot, breaks are extremely important. Micro breaks, kind of a common term nowadays. Get up every 20 minutes and walk around for a minute or two. A lot of people have desk jobs nowadays. You could also, if you have a desk job, you could look at sitting and standing workstations, things like that. There's some decent sitting, standing workstations now for about $400. The ones that were the desks like raised and lower, those are usually a couple grand. They're super nice, but they're just not affordable. They've got ones now where it's just like the desk sits on the desk right here like a platform, and you can just pull it up and push it back down. Those are about $350, $400. So there's some good options there. Okay, so real quick, how do we treat successfully then with people in the clinic here? The first step is that we look at the whole body to determine the underlying cause of the pain rather than just looking at the symptoms. And this goes into physical therapy treatment in general. So you've got a disc bulge, that's great. We know how to treat a disc bulge. Everyone knows how to treat a disc bulge if you're a physical therapist. But what caused it in the first place? That's the real key to successful treatment. Is it something you're doing at work? Is it something you're doing at home? Is it something that can be avoided or modified? You know, things like that. It could be an issue with your knee. It could be an issue with your hip. We don't know until we do a thorough exam. So that's step one. You got to look at the whole body, and especially with low back pain, you kind of look from the floor up and see what's causing those underlying issues. Step two then is learning to treat your own pain with various exercises and stretches. Prevention, of course, is in that too, but going forward, our model as therapists is more like we're going to help you solve this problem, and with any luck, you don't have to come back and see us again for it. We're not looking to do ongoing treatment. We don't want you coming in every 2 weeks for the rest of your life for a tune-up. We want you to know what's going on. You may need a tune-up. That's what massage therapy is for, right? And sometimes chiropractic. But for the PT model, we want to just help you get to the bottom of it as quickly as possible, treat it, get rid of it, and then you go on your own and prevent it from happening in the future. So that's how we successfully treat really anything, but especially low back pain and sciatica. We've got 3 exercises to relieve back pain that I want to share with you guys today. These ones are nice because you really can use these ones for any type of back pain or pain in general, whereas if you've got a bulging disc versus a degenerated disc, you want to really make sure you're not doing the same exercises. But these ones are ones that you can do for pretty much any type of pain as long as they're comfortable. So these are called total motion release exercises. This is Robert's favorite stuff, right, Dad?
You betcha.
TMR. He loves it. The rest of us are coming around to it. So we'll talk about it today. If I fumble through it at all, he'll be there to help me. So total motion release. It's different than regular PT. So a lot of times as PTs, we see a barrier. You're tight in one direction, and we push you through the barrier, basically. We say, well, this muscle is tight. We're going to stretch it. Yes, it hurts. We're going to massage it. We're going to treat it. And by and large, it does work. It's just a difficult way to do things sometimes. TMR is more or less the exact opposite of that. And so you say, well, hey, you've got a real tightness into a specific motion. Like this is really tight this way. So what you're going to do instead is you're going to work the good motion. People who have treated with my dad already probably know this stuff a little bit. So you treat the good motion. Seems a little bit counterintuitive, but actually it works. Because your brain and your spinal cord is actually, it's got some interesting stuff going on, where if you can do the same movement pattern really well on the opposite side, it'll actually carry over to the painful side, and it'll actually improve that side. And again, you're working into comfortable movements versus working into uncomfortable, potentially painful stretching type stuff. So it's a really interesting approach, and the nice thing about it is that pretty much everyone can do it because you're promoting comfortable exercise. So again, if it hurts, you don't do it, but most of these don't hurt anyways.
True.
Am I on the right track?
Yep.
So far? Cool.
Teach that to Danielle.
So it's different. Yeah, what's that? Does anyone work with Danielle? Yeah, okay. She likes to torture people.
Oh, I don't know. Give it to Melinda.
Yeah, the smaller the therapist, the worse it is. And females are worse than males. Sorry to be, but it's true. Arms are big, muscular.
He's afraid of hurting anybody.
Gentle giant. The smaller the female therapist you have, the worse you're in for. So if your therapist is ever actually hard on you, just request one of the rest.
Yeah, she's great.
It does work though, so yeah. Okay. Any volunteers for TMR exercises?
Oh, I will jump.
You want to
up.
volunteer? Okay, we got Michelle. I need like 2 more people.
I'm a skeptic, so I would.
You want to come up? Okay. Come on up. We need your chairs.
Good enough.
Better bring your chairs with us.
Okay. I'll put it right here.
I'll stay over
What
here.
the heck? And
I think I need my
for those of you in the audience, feel free to try this out on yourselves if you want to. Come on up. All right. Look at these lovely volunteers. Okay. And again, if we need to pull Robert in here, we will. I think I've got the gist of it, but. Arm raises, okay? So here's how TMR works. What you're going to do, start with your right arm, and you're going to raise it as high as you can. And if you want to, again, you can follow along. See how it feels. Notice if it's painful or it feels tight or restricted. So you're just testing the feeling. Put that arm down, and then test your left arm. See it as high as you can. Typically, even if you don't have an arm issue, one arm's going to feel easier than the other. So Michelle, which arm feels easier?
The right.
The right arm feels easier? Melissa, right? And Michelle.
Yes.
Jeez.
I'm telling you.
So the right arm feels easier?
Yeah.
What about for you, Michelle? Melissa. Oh, goodness.
It's a Michelle sandwich, she said.
It's not just me. Like,
Which one?
It was my.
Left arm feels easier? Which arm
So you
feels
got 2 rights and a left.
Okay, cool. And actually, did I skip a step here? You want to see which, if you were treating your back with this, you would want to see which back motions hurt. And then you would want to check it after the exercises. So I kind of had you.
Yeah, what I like to
that.
do, I mean,
when I get going on these things is if, let's just say, Michelle comes in with back pain, and I would just ask her, well, where's the pain at? And just have a point. And then give me a number, 0 to 10, 0 being fine, 5 moderate, 10 strong. And then, is there a particular motion like back bending that bothers you, or side bending? Usually one of those two motions, back bending or side bending, one or the other, will usually bother you. So I just like to kind of get that going as a point of reference, and then I go to what you're doing, like an arm raise or a twist. And was it your right arm was your good arm?
Right arm's my good arm.
Good. And so after I've seen, let's just say, now today, are you, for example, do you have a sore back also?
Sure. Yeah.
Okay. Okay. And how sore is it on a 0 to 10?
Probably 5.
About a 5.
Moderate.
And then I would say, if you want to, look at her motion there. Do you know, are you usually more sore going one way than the other, side to side?
Going left.
Going left. And I always tell people, don't go left anyway, so.
No. Turn right.
Little humor there for you.
Turn
So
right.
yeah, so I find out where that restriction is, how far it is in there. You know, usually it's about 20, 25 degrees. And then I do maybe the arm raises and do the good side. And then I recheck it after that. The nice thing that I really like about TMR, if you're going to take it home and use it, is you can continue to give yourself feedback every 30 seconds, every minute. If you're getting a good result, go with it. If you're not, the people that teach it say, go ahead and try it one more time. So in other words, let's just say we use arm raises to treat her back pain, and the first time she does it, her back's a little sore. The teacher, Tom, would say, try it one more time just to see if it's just not a little quirk. And if you do the exercise twice and you're still sore, then go to something else. First thing he would say is, try your left arm, because maybe the right arm's not as good as we thought it was. Then go to the left arm.
Yeah.
That's what he would say. So that's kind of the gist right there.
So again, you're constantly self-assessing. So you want to say, well, if I start with a 5 out of 10 pain, after I do these 3 exercises, is that lower? Is it a 4? Is it a 3? Then you know if it works or not. So, okay. So you were right arm, right arm? Okay. So remember which arm is your good arm out here, and then you're just going to, so go ahead and work it up. So just use the one that is less painful. So just work it up, and then you can work it up there, hold about 30 seconds, and just stretch it up. And we'll do about 3 reps of these. While we're exercising, another good thing to keep in mind is that, say you end up doing these exercises twice a day, you always want to check and make sure which arm feels either less painful or less restricted, because it can change. So don't assume. And sometimes, go ahead and put that down. Okay, we'll do it another time here. Same arm, still working the good arm. Sometimes you may think that I've got a bad left shoulder, so the right arm's always going to feel better. But if you test it that day and your left shoulder actually feels better than the right, then go with the left shoulder. So don't ever assume that you know which arm is going to be easier. Yeah. See, I listen to you. The bad things, I don't listen to them. Yeah. That's my mom. Yeah. She doesn't listen to you.
That's on camera.
That's true.
That was not a good thing to on camera, Luke.
You can hear you.
Is she in the back office still? Okay, go put that down.
Yes, she is. Got her ear to the wall.
Hi, Mom.
Yeah.
All right, and then one more time. She's got a good sense of humor. So.
While we do this one.
I thought it was your right arm that was easier.
It was, but my neck is starting.
Oh, okay.
Maybe it's my left arm.
Okay.
So
That's
Luke,
fair.
I got a question for you.
Yeah.
So those muscles run to your left side, because for me, that's actually quite uncomfortable.
Yeah.
Yeah.
That'd be where your fascia connects the muscles together.
Right.
Yeah. Yep, yep.
One of the analogies I like to use, like what Adam was saying there, is when you do one side of your body, like your right arm affecting your left arm,
Right.
it's kind of the teeter-totter effect.
Right.
Whatever you do on one side of your body is going to have some effect on the opposite side because of the crossover effect or the teeter-totter.
Now, typically, if you try these exercises too, if you just did your right arm, now try your opposite arm again. Typically, your opposite arm should feel easier. Does anyone feel? Does that feel
Mine
easier?
does.
Anybody? Yeah.
Oh, yeah.
Michelle, did your left arm feel any easier?
Oh, yes.
Yeah. Isn't that cool? Yeah. It works really well with shoulders, but it pretty much works through any part of your body.
So can you even do that
So,
a number of times a day?
yeah, you can do it
Way to
3
think
times a
that
day
one
if you
through.
want to. Yep. Yep.
I do read a lot.
Good job.
You did.
Good job. I'm impressed.
All right, so that's one.
Okay.
And then again, you would say, well, how's my back pain feel now? Does it feel any better? Can you tell? A slight reduction at this point is good. You're headed in the right direction. And again, there's a million different ways you can use TMR. We're just going to do like the top 3 because these ones are easy and they're really user-friendly.
And
But
in the
so
TMR
reassess.
program, like Luke said, there's the top 3, but Tom, who's the fellow that founded it, he's a physical therapist on the East Coast, he has his 6, although I usually don't use all 6. I usually use 2 or 3. But there's 6, and then one of his lieutenants invented another one he likes to put under the knee to the wall, the hip rotation.
Got a lieutenant?
Well, he's got a guy that does a lot of, Bill, he does a lot of work with him. Yeah.
Okay. All right, so that's your first one. Second one is a trunk twist. So what you're going to do is just scoot to the edge of your chair. With a trunk twist, you want to sit down and just put your hands comfortably on your stomach. That way you're not just twisting your arms around. And again, before you do anything, you're going to assess which side is easier. So try twisting to your right. See how it feels again, pain, restrictions, anything like that. And then try going to your left. And even if it's a small difference, is there one side that feels easier than the other? They both suck, Michelle.
They both suck. I'm like, wait a minute.
Is one easier than the other, though?
Yeah.
Less restrictive?
Yeah.
Okay. Which one's better for you?
Right.
Right? Left is easier? Left? Okay. So again, work the easier side. So go ahead and just, you'll work right, you guys work left. About a 30-second hold or so. Just try it out. You don't want to force into pain when you're doing these again because they should be well tolerated, but you can push a little bit. A little tightness is okay. Yeah. Now when you relax, just come back to the middle. Don't go to the opposite side. Just come to the middle. You're just going to work the easier side. Okay, so let's work it again to the easier side. Roughly 30 seconds or so. Good, come on back. One more. As therapists, we like to give everything a direct 30 seconds, 3 reps. But there is some wiggle room with stuff. Yeah.
Know what I heard, Luke?
What's that?
From our military, the difference between a terrorist and a physical therapist is we can negotiate with terrorists.
I like that. I like that.
Doesn't happen with you, man.
Okay.
No negotiation.
Go back to the middle. That's good. I'm going to put that up on Facebook.
Adam, did you not get the check?
Yeah. And then a real quick reassess is try the side that felt worse to begin with. It should feel a little easier after working the good side. May not feel 100%. Do you notice any difference, Michelle?
Yeah.
Do you?
Yeah.
Michelle, Melissa, any better?
A little bit.
That way? A little bit? Okay. Any better? Yeah? Cool. And then you would retest, again, if you said, well, retest your back pain, whichever motion was the worst for you, and see if it's getting lower. So if you started at a 5, are you getting down towards a 4 or 3? Typically with TMR, if you do 3 or 4 exercises, you should get anywhere from like a 30 to 40% pain reduction. So you're not expecting a miracle and go back down to 0 and all of a sudden you come doing backflips again. You're just looking for increased mobility and less pain. Cool. So third one we'll do leg raises.
Does that work for sciatica too?
It more or less works for just about everything.
Okay.
Yeah. Yep. So leg raises. Usually have folks put their seat sideways for a leg raise.
Yeah, as long as the seat's fairly flat.
Yeah. Can you guys turn your seats sideways okay? These seats should be pretty. They're sturdy.
Not like that?
Yeah, and just sit facing forward. So with a leg raise, what you're doing is you're gonna just, well, these chairs aren't that easy to do sideways, are they? Okay, we'll do your best. Well, the leg raise, you cross your arms over your chest, and you're gonna put your leg out straight in front of you, and we're gonna test first. And you're just gonna lift that leg as high as you can. So get your toes as high in the air as you can. Okay? Put it back down and test the other side. Which side goes higher? Or is easier? Oh, it's a big difference, isn't it? For a lot of folks, this is a huge discrepancy. For me, I can usually get my left one way up, my right one is just kind of doing this. Yeah. So, is there a difference for every one of you?
Oh, yeah.
Right leg is easier?
Yes.
Right leg?
I'm not doing
Right leg? Oh, we all agree. Good. So let's work the easy one. So work the right leg, if that's the easy one.
Now when I do these, I go up and down. Because keeping up in the air for that length of time
Yeah, if
is
it gets real tired,
difficult.
go ahead and go up and down a little bit. That's fine too. Yeah, I get fatigued.
It's also good for your abs.
Yeah. And you can bend backwards with this one. It's okay to, bend backwards to lift that leg up. Go ahead and put it down. Let it rest just for a few seconds. Keep working that same leg. Oh, these legs are heavy.
Try it with a boot on.
That was
Right,
your
Ted?
easy
Give
leg?
him a real reason to complain, right?
That was your easier leg, huh? The big leg? Yeah.
I'm gonna say, Susan, you should have gone with your left.
All right, let's call that 30 seconds because I'm getting fatigued. Okay, one more time with the easier leg. In PT school, they say you don't have a good leg and a bad leg. You don't want to call it your bad leg.
My right leg does hurt.
Did you feel kind of a shift in your hips when you did that?
You can a little bit.
Flip
Mine hurts
one
right
leg
here.
to the other? I
Yeah.
just did.
Yeah, you can. Oh, I'm sweating now. Okay,
Good.
good. And so
I don't
right off the
have
bat,
It
retest
hurts
the other
either way.
leg.
I can go like
Yeah,
this
no.
and it hurts.
Try it, Michelle. Come on. You might be surprised.
You gotta remember, the left leg's the bad leg
I know.
anyways.
Just try it. Is it any easier to get higher?
No.
Did you get any higher?
No.
Yep.
Are you
I
higher at
can't
least?
I'm higher, I can't straighten it though.
Okay. Oh, you have an injury.
Yeah.
Can you
I
guys
was
get
a
higher?
skeptic, and now I'm not.
I'm glad you like it.
Yeah.
Yeah.
Cool.
Very much.
So again, these are easy to tolerate. The reason I use them for something like this in a group setting is because I'm not going to go through and say you've got a disc bulge, you've got a stenosis, you've got a muscular strain, just for the essence of time. I think my wife wants to see me today. You guys probably have that.
At the rental house.
At the rental house. Oh, jeez. What are we drinking this morning? I just
Bloody Marys.
Yeah, cool. Well, let's give our volunteers a hand there. Thank you, guys. The brave three. Okay, so that's kind of your bonus for coming today. You get free self-treatment at home.
I wouldn't have believed it.
Okay. More questions?
Yeah, this would be good for you, those 3 exercises, maybe.
What does that mean when one leg you can raise higher than the other one? What does that mean?
The way TMR works again is it's more neurological. So it's the connection from your brain down through the spine to the muscles. And so typically you have the connection on both sides, but one of them is just more efficient because it's been less painful for a while, or it's just your stronger side. It's like, trying to kick a soccer ball with your right leg versus your left leg. You're just better on one side typically. So typically you just have an easier side, and when you work the easier side, you have such a more efficient use of that pattern that when you use it a lot, it'll overflow to the other side. So you can use that to your benefit. And again, the biggest benefit of a TMR is that we're not trying to push through any barriers. So it's a very comfortable way to treat your own pain. As opposed to, again, a lot of times as therapists, we push you through pain if we have to. Typically to make you feel better in the end, but, right? Just drink your coffee, yeah.
Sometimes.
Yes, sometimes. We try. You have a question there, Tim?
Yeah, should you do any of this after you ice? Is that going to affect it or cause any pain or problems?
I would probably do it when you're not ice, because ice is it's an analgesic, so you want to have accurate input as to how much. You shouldn't have a lot of pain, but you want whatever input you have. Yeah, so you might do it after you heat, and then if ice is effective for you for irritation, you might ice later. Yeah.
Now, I've heard a lot of people, doctors and such, say rotate. Do 10 to 15 heat, 10 to 15 ice. What's the theory behind that versus one or the other?
The theory behind that is that both are beneficial. In that,
Is there a sequence it needs to be first, though?
It just depends. I would say if ice works better for you in general, you would start with ice and finish with ice. If heat works better, start with heat and finish with heat.
What about after you put a couple of rub on?
I would probably do these before that again, because if it's an analgesic type of a rub, yeah. And again, the difference with heat and ice, sometimes we will use it going back and forth. The heat opens blood vessels, so opens extra circulation to that area, and the ice closes them. So a lot of times it is beneficial to go back and forth because you open the blood vessels and then you close them, and you open them and close them. So it's kind of like a pumping effect. You're moving stuff through there. And that can be a big problem with an injury, is that if you don't move a lot because it hurts, you're not getting that adequate circulation to the area. So you just need to bring in more blood and more oxygen and more healing capacity. Yeah. Go ahead.
I'm currently seeing a chiropractor, which I never would have thought I would do, but I got in so much pain that I was desperate. So what would be the difference in physical therapy as opposed to chiropractic care?
The main difference, and it depends on your chiropractor, but the chiropractic model is a little more of a maintenance model. So they will treat you intensely, sometimes 4 or 5 times a week initially, and then they'll try to taper you off. And the good chiropractors will kind of just say, "We'll come back when you need me." And the really good chiropractors will actually kind of get into the PT area where they'll try to teach you prevention. The not so good chiropractors will just treat you and you're dependent on them. So that's the biggest difference in mentality of treatment, is that we're going to get you through it. We're going to teach you what's going wrong. And with any luck, after you're done with us, you won't have to come back in for the same thing. We do get a lot of repeat offenders though, of course, but it's usually a different injury. Like you came in for your back and then a year later you came in for your shoulder. Yeah, repeat offenders. I like those people. Yeah. Good. Any other quick questions on all that stuff?
I have to make sure I have it right between discs and sciatica. If you bend forward and it hurts, it's a disc?
If you bend forward and it shoots pain down your leg, it could be the disc bulging to touch your nerve. Yeah.
Okay.
That's the most common.
Okay. I couldn't remember which was bend forward and bend backwards.
Yeah.
That would be the stenosis.
Yeah. And actually,
It hurts.
are you an online person? Do you go online at all?
No.
Okay. Never mind then.
Okay, so is there a place my husband does? I haven't.
Well, I've got a couple blogs on determine which one you have, and videos as well inside the blogs. So if you go to our website and go to the blog, probably got 4 or 5 on just the stuff that we're talking about. So if you want more information, there's videos on it, there's my writing on it and stuff, and it kind of it differentiates a little bit.
Oh,
yeah,
okay.
so videos are always good for that stuff.
I'm digitally camera.
On. Yeah.
He's my secretary.
Nice. So now that you know a little more about what's going on, what next? Yes, what next? What is next?
What is next?
What's next? So we just talked about that. What does PT do for me? So if you're in a position where you say, gosh, I've got this back pain, I understand it a little more now, and I want to get treatment, PT can help you with that. You know, that's what we do day in and day out. If you're kind of on the fence, you say, gosh, I don't know, maybe I can treat it successfully on my own, or maybe I don't quite need PT yet, we have another option for you as well, and we call that a discovery visit. So what a discovery visit is where you get to actually go and have a 30-minute session with one of our PTs, and they'll just look at you and they'll give you an idea of what's the cause of your back pain and what would successful treatment look like for you. Because again, everyone in this room is different. You could have similar types of back pain, but the underlying cause is probably different for everyone in this room. So that's something that we offer. It's that's a free session. So it's 30-minute sessions with one of our PTs. There's no strings attached. You don't have to commit. You don't have to give us your insurance information. Although we probably pretty much have everyone's information anyways, right? Since you're all previous people. We won't use it though. So we have a discovery visit. And again, you're going to learn exactly what type of pain you have and what successful treatment would look like for you. So that's my last slide. Any questions on that?
Joe?
Cool. Yes. Any more last questions? I'll be up here afterwards actually if you want to ask me individual questions. If you know you're ready for physical therapy, Stephanie will help you schedule, and we'll work with you on getting a referral from your doctor. Is that right, Steph?
She's not good.
She's waving at me.
Excuse me.
If you know you want a discovery session, Steph will help you schedule that too. So, I think she is.
It's with your mom.
Steph, are you ignoring me?
She's talking to mom right now.
Somebody.
Mom trumps me every time.
Get used to it.
Yeah.
Sorry, Marcia.
I was just telling them if they're ready for a PT evaluation, you'll help them schedule. If they're ready for a discovery visit, you'll help them schedule that too. So.
Yep, I hold my head.
And hang out, talk to me, talk to Robert.
So,
Cold laser. There's some good stuff about cold laser. Yeah, for increased circulation.
What is Lisa think?
We don't do laser here, but yeah, there's been some good studies on that stuff.
Yeah, there's so much stuff now, hype, and you don't know if it's just hype or if there's really something to it, you know?
Well, the thing is, the more people get in pain, the more people are looking for like the one thing.
Yeah.
What's going to cure me? And as a kind of a tangent, but kind of as a society, I'm looking for a quick fix.
Injected your back?
Can I take a supplement? Can I take a pill? I mean, there's a lot of natural stuff too.
Have you heard of the ground up rooster cones?
Oh yeah. Yep. There's that. There's any type of thing. There's
They
antioxidants.
injected, there's some
Put in your
chemical
time
in
and
there
you've been in
supposedly they
pretty extreme pain now
injected
for
into joints or
9 months.
something.
Yeah.
whatever's been sore.
lubricates them,
In
or
my
I don't know what
opinion,
it
yeah,
does,
I
but
would.
it's supposed to help something.
Yeah, it's a
Decide
lubrication
what's
type
best for
thing.
you.
Yeah, and I thought,
Yeah.
Which one?
nothing else, you can get up in the morning and crow.
That's right. Did you lay an egg today?
How do you know that?
Yeah,
But a lot of people push that on. And as a PT, there's a lot of those solutions are multi-level businesses
And they
too.
think that that's.
So you sell this supplement to your
Are
friends,
they pretty sure that's what it is?
and they sell it to their friends. All of a sudden, you've got a
Like
second.
a pyramid.
Yeah, you've got a second stream of income. And so people approach therapists all the time and say, "Well, you've got all these patients who are looking for something. You can sell it to them." It's like, well, I kind of sell physical therapy actually.
Well, that's
I think it works.
Why
I do
not?
sell like nutrition. Like
put me through the
you probably heard me ramble on about nutrition.
No, I have.
Yeah, but I mean, those are things that you can do.
He laid me down.
Yeah, but just selling nutrition
That really hurt, huh?
coincides
Try to tap
with.
Yeah.
I do.
I don't
Nutrition
teach.
isn't gonna hurt you. You know,
Yeah.
right, you're not telling us to go out and
If I own a restaurant,
You know, I don't think I've ever
eat some
known
funky
a fusion of
green
this. I-
thing that
except for kombucha, right? Kombucha's pretty fun. Remember kombucha? Nobody?
No?
Fermented tea?
Oh.
Yeah,
Does anyone yeah, do you guys do probiotics at all?
Does he,
Like a
what kind of a
probiotic
result
vitamin?
does he?
It's like the
I mean, I know
beneficial
he can't guarantee
bacteria.
anything.
There's a lot
Does
of
he really
research
think he
about
can help you?
bacteria.
Oh.
But kombucha is
You
the
wanna
most cheap and fun way to get it. It's fermented tea. I actually have a video about it.
Does it make you happy?
Yeah, you want to drink
Tastes
it?
very
Right,
well.
as a test.
I love the taast of it.
Do you really?
You can
If I
flavor
was
it with fruit
you,
and
when you
stuff,
talk
but
to him and say, well,
I have a video on that too. My son and I made
I
it like
tend
a
to
year
agree
ago.
with him. Yes,
And I got all these YouTube videos.
problem.
The
But
kombucha video was my
if you
number
do
one
this,
most popular video by far.
what can I expect? And be honest
But
with
you make tea, like I make green tea in a big jug, and you make it into sweet tea.
Sure, the more
So you
information
put,
you get,
like,
but I would
half
have that
sugar into
conversation
it.
with him.
And then you have this
He's your surgeon.
SCOBY.
He's like, well, you know,
You ever seen a SCOBY?
I mean, I don't know.
It looks like a
Dr.
big mushroom. It's like a jellyfish.
I've worked with him over the years in my office a little bit, but I don't really know.
But it's SCOBY,
He's done good
SCOBY is an
work.
acronym for
But this is, you know,
symbiotic colony
all
of
out of the
bacteria
ordinary for
and
back
yeast.
surgery.
And so it's
all
bacteria
bacteria
and yeast, and it
are
eats the
bacteria.
sugar. And as it does that, it ferments the tea.
Yeah, exactly.
And the
Well,
longer
I'm
you
not
let
telling
it
you what
ferment, it
to
starts
do,
to
but
taste kind of vinegary.
I would just say,
apple
well,
cider
what can I
vinegar.
reasonably expect?
If you
I
don't
mean,
let it
I
ferment very long, it can
wanna
taste
get
pretty sweet
the
still.
quality of life that
But
I have with this, and
the benefit you have is that
you're
it's
a very
like
good
full of
surgeon,
bacteria.
but
And so when you drink
what
it,
should I expect out of this?
sorry, long story.
What am I going to do after the surgery?
Is what? You know, I read a lot on that, and yeah, people swear by it for a ton of stuff.
In the meantime,
I drink
you
it like
see
as a
next
tea
week.
once in a while. I'll put like
You
in
know,
water,
your
like
surgeon
some
will
ginger,
come.
cinnamon.
Do you think you could talk to his staff?
But I
and
like
say,
strong flavored stuff.
What do you know about
like
this?
when I used to drink
Because,
beer,
at
I
times,
liked
that guy's done even big
IPAs.
as
Right?
that.
Like when I
But he's
drink
over on the
alcohol, I
coast.
like
Maybe they could
bourbon.
give you
Like I
some
like
more
strong
information.
Not Scott. Shame on you.
I never got to Scotch. That's an acquired taste, I'm pretty sure.
Yeah.
Yeah, bourbon's kind of an acquired taste too, though.
I can bring you a cognac next time I
Yeah.
come. You can take
That's
that
a
home and
cognac,
try
yeah.
it.
But see if you can get some
Yeah.
information
Fireball.
specifically.
Oh.
I mean, you're always going to which is fine. But
Did you
more
read that
information
article
you can
about
find, just ask
Fireball?
the questions
That's
that are
like
really
deep
important to you.
Yeah.
Yeah, because I like
No
it.
wonder it's so bad.
And the reason that came out was because we accidentally shipped the
But you know
US
what I'm saying?
Fireball
As a
to
perspective,
Europe.
it's like, if I'm gonna
Europe has
have 40
stricter
years,
standards than us,
I
so
want
you
a
can't put
quality
paint in
life
your
that's
alcohol in
in
Europe,
there.
but you can in the
So
States.
tell me.
Cool. So Europe sent back like 40,000 cases
Convince me
because
that
they said,
this
well,
is the
you
way to
can't
go.
give us US Fireball,
You've
you
been down
got
this
this
road
Europe
so many
Fireball.
times.
Wow.
That's what I would
Wow, huh.
Because we all
That's
have
one of the
feelings.
funny things with alcohol
You know,
is
if we're
everything
not
in the
concerned,
States, like for food,
we
is
wanna make sure
nutritional,
that
it's labeled, you
we
gotta
get
label the
more
ingredients.
Right.
You ever notice in
But it's
alcohol
true.
there's no ingredients?
No.
Yeah.
But a lot of times
You
people
think
are
wine, you think
reluctant
wine is
to
made with grapes
ask
and
a
yeast and water?
professional about these because like,
You'd
well,
be
yeah,
surprised. 2-buck chug?
you know,
Google that.
get those answers up
What's in
front.
2-buck chug?
Get their opinions up front.
Yeah.
Do we want, wait,
Do you want, yeah, but do you want to know what's in it?
No.
Remember that.
I don't want to drink it or know it.
Exactly.
You're gonna do one of those appointments?
What's that?
Yeah.
So soft.
Better go talk to Stephanie.
Well, I
Is
don't
that another cute? Oh, for yeah.
pay for the
Well, that's
$2
not
chug.
It could be.
I like the sounds of that.
Apple cider is a funky one too. You think
Yeah,
apple cider is made with apples?
The real issue is
You know, I saw a
surgery,
billboard
is
for
we fix
Angry
the
Ocean
issue.
the other day.
We
It
have so
said
much
2
scar
apples
tissue.
in every bottle It's like 2 apples. That's like that much juice.
Meniscus out of knees?
There should be 20 apples in that bottle. What's the other?
The other ingredients.
What they're promoting? You're like, wow, it's 2
Yeah, I used to
apples.
see them all the time.
I know. Isn't that funny?
You ever squeeze the juice out of 2 apples?
How are you, Robert?
Hey, good. How are you? Good to see ya.
Thank you.
How you been?
Not so good.
Oh, I'm sorry.
Oh, real.
Press all them apples.
I
Too much
haven't
plane
had
travel.
those in
Sitting in a
years.
plane.
Yeah.
If you
Okay, so
compare
we're
like
going
a
back to
real apple
Australia?
cider, 100% apple,
Yeah.
versus a
Yeah, last time was for 15 weeks, but it's a
Well,
23-hour flight.
You know what I mean? If you look at the flavor, look at
Oh, you're on the other side of Australia.
the
too.
texture,
If I recall.
12,000 miles, yes.
I'm from Apple Country too, where
Real
there's nothing
cider.
like
Well, do you
real
have
homemade
apples?
cider.
I may have
Just
to,
before
yeah, I'm gonna go see my wife at a few appointments.
Very informative.
Good, I'm glad you came.
So I'm gonna check when they
Be here if you need us.
We didn't even add yeast.
Yeah, no, I can do for you. Just let us
Thanks,
know.
Luke.
Anybody else need
You look good.
Yeah, I wish I felt as good about it. That's the way life is. I guess when you get old, you get problems.
Yeah, they. Not quite what we thought it was going to be.
No,
Yeah.
not the golden years, the
Yeah.
rusty years.
Now, are you with Dr. Hathaway?